with Facebook as well. Okay, if anybody can hear us on Facebook, if you could please just chime in and let us know, just throw up a little comment there. So we were just talking about lifestyle is really the way to keep your immune system up the best. So we just have a question coming in on vitamin D. I'm gonna talk about that in just a second. But yeah, Danny's got it. Sunbathing is really the best way to do that. So there are getting enough sleep, getting enough sunlight. Also, in terms of the basics, exercise, but mild,
Wash your hands.
not overdoing it. Well, washing your hands isn't necessarily going to keep your immunity up. That's
Well,
just
I know.
something.
I'm just saying like the generic things.
Right. So, those are the basics. Now, if you want to know certain vitamins that they're looking at and things like that, so there's the vitamin D that there was just some questions about. And vitamin D really, there have been a lot of research studies in a lot of areas, but the best way to get your vitamin D is really through sunlight for many, many reasons. And there is an app out there called D-Minder. It's D-M-I-N-D-E-R. And D-Minder will help sort of track, depending on where you are, what the UVI level is at the time of day, and help you sort of get enough vitamin D, and it'll let you know all of these and keep track of all of these sorts of things. So that's really the best way to do it. There is some indication in some of the studies that people up north in some of the Scandinavian countries, they didn't get hit as hard because their diets are high in vitamin D. And if that ends up being true, then it could be that vitamin D supplementation may help. But I'm very suspicious of vitamin D supplementation. There's also some new studies coming out with related to the use of glutathione to help keeping vitamin D levels up, and that's something that you're going to help to keep up. Glutathione is a detoxification enzyme, and essentially that you can get through eating, a variety of fruits and vegetables. That's basically diet is through is another way. If you wanted to supplement, you can try something like N-acetylcysteine or some of the things that help preserve it, like lipoic acid and so forth. But I don't really recommend a lot of that stuff. Really, in terms of if somebody's going to take supplementation, the things that I would recommend considering are the basic things like vitamin C, things like zinc, in not too high quantities of zinc, but zinc seems to be something that may be able to play a significant role in stopping the virus. But zinc by itself doesn't really seem to be able to do it. It has a hard time getting into cells. So what happens is that there are things that help to transport zinc inside, and that's, you heard a lot of stuff about hydroxychloroquine, and whether that works, whether that doesn't work, and the study comes out and says it doesn't work. Well, they did these trials on hydroxychloroquine when the theory, the hypothesis is that the way hydroxychloroquine is working is by helping to transport zinc into the cells. But they did the study without zinc. So, of course, it's not going to work if, in fact, the zinc is what's doing it. But there are other things besides hydroxychloroquine that can help move zinc into cells. And a couple of those things are things like green tea is one of them, ECGC, a component of green tea, and quercetin is another one that you can find in, it's high in onions, particularly the skins, I believe, of onions. And apples. Citrus fruits. Yeah. So those are some of the less, and again, with the caveat that those are not very well studied. What is very reasonably well studied is actually Chinese herbal medicine. And I'm not just saying this because I'm an acupuncturist. These are really basically some of the only things that are well studied. And the reason is because China actually, they ended up incorporating Chinese medicine into into the way that they were... Okay, into the way that they were treating COVID. And as soon as they did that, the death curve of COVID went from sloping up, and it did sort of a 90-degree turnaround within about a week of them instituting that. And so the Chinese government got really interested in that, and the herbs and so then the herbs were studied, and of course they're studying the herbs because they want to isolate a molecule inside of the herb so that then they can go and patent it, and then they can come up with the miracle drug. But in the meantime, we have a lot of great research that's showing that the Chinese herbal medicine is able to block the viral entry, able to stop replication, able to do a lot of different things. And we've treated probably around 20 cases or so of COVID. Of course, we're doing this telemedicine. When we're doing it using Chinese herbal medicine, and in the vast majority of cases, we've seen turnarounds very quickly. So there are a couple that have taken longer, but in most cases, it's been, we're seeing clinically that these things are panning out even in the United States. So we don't think that China's making these data up. And so that's basically, in a nutshell. Acupuncture, of course, can help to upkeep the immune system. I think Wendy's been posting some things about that. There are a number of studies that have been done on this type of thing as well. But really, I would focus on the basics. The most important thing is to get enough sleep, to get enough sunlight. The sunlight's also going to help your melatonin. And by the way, don't wear sunglasses when you're out in the sunlight all the time, because the sunglasses are going to block a lot of the UV light that tells your brain that you're actually being exposed to the daylight. So it's better to be out and actually look, at least for a little bit. You don't have to keep your glasses off all day long, but maybe 10 minutes, 20 minutes at least you can look outside and allow the UV light to get to your eyes.
Well, and then the D-minder would be able to tell you, based upon where you are in the country and what the weather is like that day and your skin tone, how much time you actually need to synthesize the vitamin D.
Right, so you can get that sort of information. Okay, so let me see if there were any questions about that one. Oh, wow.
Someone had asked about elderberry.
Elderberry, there's some fairly weak evidence that elderberry is helpful. There was some evidence. There was something going around on the internet saying that elderberry is going to make a cytokine storm happen, and that ended up being totally bogus, like many things that run around. There was absolutely no data behind that. It was just somebody who thought about it. So I doubt that's going to be a problem. So if you want to take elderberry, I'd say I doubt it's going to hurt. It may help, but that would be towards the very beginning. So there are things you could take at the beginning. And by the way, if you want to talk about things to take at the beginning before you get sick, then you could take basically some garlic cloves, and you can take a needle and thread and run a string through it and put it around your neck, because garlic is one of the few things that they have actually studied, and it does help to block the entrance of the virus. So the old sort of vampire prophylaxis trick seems to potentially work for SARS. So that's another thing you can do. Of course, you could also, if you didn't want to be that dramatic, you could incorporate it into your diet. And also, actually, if you take garlic cloves and you put it in your shoe, you can you can smell it on your breath later. So that's an interesting thing with garlic. So all right. So was that all the questions on the immunity? Then we'll move on to the next question then. What was the second?
Yeah, I can't find the other because it's on the phone, and we're using the phone for the.
Oh, okay. So let me.
But I know there was a question
can we pull
about.
it up on your?
Well, we had a question about air travel. Like, when is it going to be safe to travel again?
Okay. Okay. So air travel. This is going to get into my philosophy on things. So a lot of this stuff about COVID, the data on COVID is changing so rapidly. There are hundreds of new studies coming out every month. Or every week even. I mean, it's crazy. One of our friends was saying, I was talking to her about something. She's a microbiologist. She was saying that it's like drinking water from a fire hose. So there's just an enormous amount of data, and the data changes daily. So what my philosophy is on these things is sort of like, let's see what happens to other people first. So you basically with air flight, okay, if they distance people, I don't know, if they're seating them apart and they're running HEPA filtration through and everybody's wearing masks, then okay, sounds good. But I don't want to be the first person who jumps on a plane and see what happens. So it's one of those things that, as far as travel, I would wait personally, unless you really are not worried about this, in which case you probably wouldn't be watching this anyways. So. Well,
and then I think, Corinne, I think Brandon was joking about putting garlic in the shoe or sock. Were you?
Yeah, I was joking, but it does get into your circulation quickly that way. I mean, it'll absorb into your body, so it probably would help protect you. But the idea is probably to with the garlic cloves around your neck, that would probably be more effective because you'd be breathing in some of that. But
there's background noise. I think it's the thing.
Oh, the fan from the.
Yeah, the fan.
Here, let's move this out a little bit. Why don't we? Because we don't really need this, right?
No.
Why don't you get the kids to hold it then? All right. So if you're
I need something.
if it is actually if it comes out on your breath, then most likely you'd be
Close it.
breathing it in anyways. Close this.
Yeah, because then we'll use the iRobot thing.
Okay, but then I can't read the questions. But all right.
Here, just hold this for now.
Okay. So sorry about this. We want to make it so that so that you can actually hear. All right. That's fine. Can you help me set this up?
Yeah.
All right.
Is the background noise better? Whoops.
Okay.
Okay, cool.
All right, great. So then another question.
Oh, there was, do UV rays go through contact lenses?
That's going to depend on whether your contact lenses are, I'm guessing that they'll manufacture them to block ultraviolet light, so probably not, but it's possible you'd have to just check what kind of contact lens that you have.
And then here, biomarkers of monitoring.
Here, somebody wants to see you.
Oh, thanks, Crystal.
Biomarkers should we be monitoring, especially with reports of damage to kidneys, liver clotting, etc. Also, what about the recovery stage to ensure we effectively clear the virus? When you're talking about biomarkers, what are you referring to? Are you referring to testing?
To labs.
Lab testing for the coronavirus?
We were talking to Gabe about that, and we're actually going to come up with sort of a list of what we recommend that you get checked with your doctors if you have been COVID positive, because I think in the future, even for people who are asymptomatic, who knows what kind of collateral damage it does. So there are certain things that I think we will come up with a list of what we want your physician to check.
Oh, I see. Okay, yeah. And in Chinese medicine, honestly, what we do is we're checking pulses a lot. And so when we check someone's pulses, we're actually seeing how the blood's flowing through the different organs. And so we'll feel, if certain organs have problems, we start feeling the blood flow starts getting a little bit strange. So sometimes they describe it as, what's that? Yeah. Sometimes they describe it as being choppy or being tight. So there are different changes that can happen, and so we can monitor it that way. From blood work for right now, you can just do basics, CBC, CMP, if you know comprehensive metabolic panels, it does check your liver, kidney function overall. But these, what we're doing is we're right in the process right now of compiling all the different ways that the coronavirus can damage the body. And what happens is it does go into, it seems that it's going to be going into a latent phase, or it seems that it does go into a latent phase. And so what that indicates is that there's going to be some hunting around that we're going to have to do and see, what happens with the virus in general. But what I wasn't sure is if she was asking about testing, what kinds of testing that are you getting the questioning? Okay. Yeah. So while she's pulling up the questions, any other? Pregnancy. Okay. So with pregnancy and COVID, it's a short answer is that we don't know yet. Basically, it's too new. It doesn't look like it's causing any problems. It doesn't look to be any worse than a normal flu. In our experience so far in treating it, in maybe something like 20 cases, it doesn't seem to be, for most people, it doesn't seem to be much worse. Of course, we've interfered with herbs, so it's maybe something like a bad flu. We don't know about first trimester yet. The data we have coming out of the reported cases from second and third trimester is that it's not really causing any more issues than what a normal flu would. Okay, next question.
And then the next question, projections for treatments and vaccines.
Projections for treatments and vaccines. Okay, but they wanted to see you.
Oh, that's okay. She saw me.
All right. So as far as treatments,
COVID twice.
Can you catch? Oh, okay. Danny wanted to know if you can catch COVID twice. The answer is yes, according to the case reports. And some of the things that are coming out recently will answer sort of both of these questions. What they've seen is that a huge percentage of patients, the levels of antibodies. So if you guys know that after you get sick with an infection, you often produce antibodies, right? And these antibodies are supposed to protect you from a subsequent infection. But what's happening in COVID is that, and this does happen in other diseases, not just COVID, but that the antibodies are disappearing fairly quickly. So within about 3 months, the antibodies have dropped down by about 70%. And so you have, and this is IgG antibodies for those who are more technically minded out there that are dropping. I mean, obviously IgM isn't going to last that long. But this is a problem, because not only is it a problem that you could potentially get reinfected, and there are case reports already of people getting it twice. Not only does that leave that possibility, but it also is a bad news for a vaccine from multiple standpoints. So the first standpoint is it's bad for a vaccine, because if a vaccine's generating an antibody response, if it even is similar to a natural infection response, the antibodies are going to go away after a few months. So you'd have to get revaccinated every couple months or so in order to maintain certain antibody levels. But the second problem, and something that's worth, I think, thinking more carefully about, is why would the body reduce the antibodies by that amount that quickly? So to me, that indicates that there's some potential risk involved in these antibodies that are being produced, and the body doesn't want to go there, and so it's reducing it. Because why would somebody go through a severe infection and then clear the antibodies out when you create antibodies to chickenpox, to varicella virus, and those will last decades, if not your entire life. So, you have to sort of think about these things. And so that's also going to, it's the same as my answer to the vaccine question is going to be the same as my answer to the airline question. It's going to be, I wouldn't be the first person to go get a vaccine. And also, I personally not only don't think the vaccine cannot work, in the standpoint, from the standpoint that it cannot stop COVID. It's not really possible, because COVID doesn't just infect human beings, right? We know that we got it from animals, and there have been studies in animals, and particularly cats tend to be extremely susceptible to getting COVID. So unless you could vaccinate every cat and every feral cat and figure out which other animals in the entire animal kingdom can be infected with it, this virus is going to keep going around and keep mutating. And so, I really think that vaccines is not the right way to go. I think what we need to do is develop treatments. Now, someone asked about treatments that are on the horizon. There are some very promising treatments that are on the horizon for this. So one of them is, more of a treatment if you have severe disease already. You don't want to use it if you're just at the beginning. It would have the opposite effect for you. But they're using like a corticosteroids, like dexamethasone or something like that. And that seems to be, preventing maybe, I think it's a third or a quarter of deaths. It's very significant. So that's something to consider for people who are in severe disease, and now they know not to throw people on ventilators. Again, this is why you don't want to be the first person to have, COVID, because they don't know what they're doing in treating it either. Then after, some experience, they know, 90% of people going on ventilators are dying. Let's just keep people off of ventilators as much as possible. And so, again, going back to the vaccines, I think that this is going to be an area where, they're rushing it also. So they're not testing it well. And I think that, not only, sorry, I was jumping around a little bit, but not only is that not going to work, it's going to be potentially dangerous for people, because we don't have thorough safety studies on this particular vaccine. The other thing that they've been looking at in terms of actual, curing this is they actually, they genetically modified cows. And I really don't love the idea of this, but they genetically modified cows to have human immune systems. And then they infect the cows with COVID, and then the cows generate antibodies, and because they're really large, they generate a lot of antibodies. And so then they take their serum, and they take their blood, essentially, and then they get the antibodies out of that, and then they use those antibodies in humans to basically stop the virus, as if you had your own immune system already intact, the antibodies and so forth. There are probably other components in there besides antibodies, maybe transfer factors or whatever type of things that come in. But either way, I think that's something, these types of things have more, I think they're something that have more of a chance of working, in my opinion.
There were a couple of questions that I just wanted to answer. If I could figure out, yes, I will put it on IGTV and on our Facebook post, our Facebook feed. So if you came late, you can watch it later. Karen asked about, can you get it twice due to reinfection or reactivation?
Yes, you can get it twice. You could get it multiple times. We don't know the answer to exactly what's going on. That has to do probably with what I mentioned about the antibodies dropping down in most people quite substantially. There's a question as to whether it's safe to come into the clinic if somebody is pregnant. You know, in our clinic, we only see people who do not have any symptoms. And that was actually another question that was sent in. You know, what happens with, you know, if somebody's, what was the question exactly on asymptomatic?
Why are there contradictory reports about asymptomatic people's potential to infect?
Okay, so contradictory reports on asymptomatic people. So basically what it is there are a lot of different studies that have come out, and these are not homogeneous. So meaning basically they are, you know, there are some of these studies in asymptomatic people are looking at people with masks, some people don't have masks, and they're in all kinds of different situations. What we've seen so far from the data and what makes the most sense in terms of what we know about transmission is that asymptomatic people, when they are wearing masks and when the potential victim, I don't know what you call us, victims are wearing the masks, chances of spread are extremely unlikely. You know, I don't know of any cases that have been established where both parties are wearing masks and everyone's asymptomatic that's actually infected anyone. And in fact, there was one study where they traced every single person that this woman came in contact with, which was like 100 and something people in her family. She had a huge family, I guess, and including all of the people in the hospital and everything. And she came in contact with 300 and something people that they traced her to, and not one person got it. But in that particular case, everybody were wearing masks. And so that's something that I personally feel is one of the most effective measures in preventing the spread of this disease is masks. And I know I have some colleagues who I very much respect their opinions, who very much disagree with me on masks. But, you know, to me, it's one of these things. There's certain things that to me, you know, even if you can argue about the data here and there are certain things that are fairly obvious. If I go up to a mirror and I sneeze on the mirror, okay, I'm going to see a bunch of droplets all over the mirror, okay? If I put a mask on and I sneeze from the same distance to that mirror, I won't see anything on the mirror. And so, you know that having a mask on is going to lower the spread. Now, does it completely prevent the spread or not? I mean, you can argue about those types of things. But as far as asymptomatic is concerned, we're not concerned with that at all. And so in terms of pregnant patients coming into the office, we've had no problems. We have nobody in our practice who has gotten COVID that we know of that could have even possibly gotten it from our office. The only people who I have who have come in and gotten it there's one exception, but the only people have been people who've traveled to New York, or we have somebody who was, you know, like they were working in a place where nobody was wearing masks because they were in an essential position and so forth, but they didn't come in when they were symptomatic at all. So from our policies, we have no concerns, or we would not be open if we had any concerns about it. And also, we take an enormous number of precautions that I won't go into right now, but we have some of these listed on our website. And if you're concerned at all, just, you know, you can always send us an email. We'll give you all of the things that we're doing on that. What was the next question?
Yeah, so we had a few, let's see.
Transmission amongst children, that was one of the questions also.
Right,
with schools
school.
and so forth. Okay, so kids, it's going to depend on the age.
And college. Someone asked about college.
College, okay. Yeah, okay, so kids, it's going to depend on the age. Basically, what happens, and by the way, I want to say again that these are all my opinions. These are all it should be obvious, but these are all just my analysis after reading an incredible amount of data. This is my synthesis of the data, okay? These things could change at any time. My opinion could change tomorrow if I read something about these things. But for right now, with quite a large volume of what I've been going through, this is how I see things. Now, in terms of children, I'm not concerned with children if they're wearing, you know, for example, wearing masks, and, you know, they're relatively social distancing. So they're not wrestling or something like that. You know, if they're asymptomatic, I'm not, I'm not really worried at all about kids playing outside. Okay, I think inside you're increasing your risks. So my children, for example, they can play outside. Like just the other day, we had my kids were out on a slip and slide, which was actually perfect. They were outside with some other friends. They had this plastic thing on the grass with some cardboard underneath it, and they put a bunch of soap, dish soap
Dish
all
soap
over
to make
it.
it slippery.
Right, and sprayed water on it. And so, of course, the dish soap, as you know from washing your hands, that basically it breaks up the envelope of the virus because it's lipid. So the dish soap is sort of anti-coronavirus in and of itself, and they were having fun playing together, sliding along the slip and slide. So again, if it's outdoors, chances of transmission among asymptomatic people is, in my assessment of it, is almost none. There's almost no chance of transmission if everyone's wearing masks. If the children are very young and their masks are off and all these types of things, that's another story. So you have to sort of gauge with your children, how that would go. So there's sort of like a bell curve here, right? So really young children, it's unlikely that it's going to be okay. I mean, with very young children, you won't be able to distance them. And then at the same token, on the other end of the spectrum, with college students, it's probably they can't stay away from each other. They don't like rules. They if it's like it was in my dorms at Ohio State, then they had something like 4 people, 4 people in a room or something. If they have these kinds of things going on still, then it's probably going to be tough to isolate. Because one person gets sick and then it's just very easily transmitted. So that's my feeling on children and playing. I'm not real worried about transmission among children outside with masks on. In schools, that's another, that's a whole nother ball game. It depends what the school can do. I'd imagine that private schools could manage it. I know the school that our children are going to are talking about how they're going to be doing it. They're going to try to double up with Zoom and with in person. So, people don't want to come in, they don't have to. And then if anybody has any kind of symptoms, they're sent home immediately. I don't know, or if they're not following the rules, I don't know if in public schools you can do these kind of things or not. So you're just going to have to take a look at what your school is doing and then see how that goes. All right.
So then Eric had asked about it being like a hypercoagulability issue.
What about it? About the...
just like is it really turning out to be something that affects the cardiovascular system?
It does, yes. For sure, it affects the cardiovascular system. And we're seeing that even in the patients after they've recovered, and then they come in, and we're seeing what kind of damage is left over in the body. In most cases, we're seeing some cardiovascular sequela from COVID. So that's one of the areas that we look at really closely. Obviously, the lungs, the heart, the cardiovascular system. We do see some with the kidneys, not as much with the kidneys, but there have been some with the liver, these types of things, usually depending on therapies.
How long does it take for the virus to mutate? I don't think we really know that yet.
Well, the virus is mutating the last study that I read on that, it's mutating at about half the rate of the flu. So it still mutates quite a bit. But there are certain areas, there's, I don't know, we should even get into this, but there's one sort of subsect of the science community, very, very tiny subsect that is more on the conspiracy lines of this, that it was some sort of a designed virus or something like that. And most of the scientific community doesn't believe that. And so basically the one portion that causes it to be very infectious to humans, and one of the reasons why, it was kind of interesting actually, one of the studies that they did, they did a computer modeling study to see what animals COVID was binding to the easiest so they could try to discover which animal it came from. And nobody was anywhere close to human beings. Like humans were way beyond anything else, so that's one of their justifications for saying they think it was engineered. But anyway, that particular area that's binding to the ACE2 receptors in humans, I guess, that area is not mutating very quickly. But there are indications that it's mutating to become less virulent. And in general, most viruses, in order to be successful, you really need to mutate to become less virulent over time. And the reason for that is if you keep killing your hosts off, you're not going to be able to spread anywhere, right? I mean, it's like if you're a drug dealer and you're killing off all your customers, you're going to go broke eventually. So, the best thing to do is just to keep them alive as long as possible, and then they'll be, customers. Anyway, I won't go into, those types of things. But that's sort of the idea that viruses, go on as well. typically. So you'll see this in many viruses over time, that they become less deadly. Let's see, other questions?
There was a question about Chinese herbs. So do we take them as a preventative or only upon onset of symptoms? We actually recommend taking both. If you're doing something that's high risk, then I do recommend taking preventative herbs. And we do have herbs in our office that we've been giving to patients. They're sort of prevention. And then of course, like at first onset of whatever symptoms, usually, we found that when we treat it right away, we can nip it in the bud.
Yeah, and for most of my patients, I had them taking prophylactic herbs at the very beginning, and then after a few weeks, when they weren't around anybody else, they didn't have it. Then I said, you don't really necessarily have to take them unless you're putting yourself in a higher risk area. But once things open up again at the beginning, you may want to take it again. I think the lifestyle, that's going to be much more important than taking prophylactic herbs. If you're in a situation where it seems to be higher risk for you, or you are higher risk, you have obesity, you have cardiovascular disease, you have these types of things, diabetes, then that makes more sense to take prophylactic herbs. But absolutely 100% for sure, at the first sign of getting anything, get Chinese herbal medicine. It can make such a huge difference in whether that turns into a severe disease or not. And this is not just me saying this. This is from a lot of experience that they have in China. And right when the coronavirus came out here, we had a number of conferences with our colleagues in China, and they were giving us advice based on what they've seen, and their advice worked very, very well. The selection of herbs that they recommended, the timing of things, and they were saying get on top of it as quickly as possible, be very aggressive with it, and you can prevent a lot of problems, and that's what ended up happening. So, okay.
Let's see. Oh, there was also a question.
Second wave question here. Or wait a second.
I was just going in order. Because I'm writing them down as we go.
No, I mean from people as they're listening, or no?
Oh, I mean, whichever. I've just been writing it down as people ask questions.
Oh, okay. So I don't want to lose all these, though.
No, I already wrote it down.
Oh, you wrote them. Okay,
Yeah.
Sorry, go ahead.
Okay, so if everyone else isn't wearing masks, is our mask ineffective?
If no one else is wearing masks, it's not as good. Okay, so again, if you take the sneeze example that I gave, and just take two people instead of a mirror, right? You go up to your friend and you sneeze in their face without anything, okay? And then
like any 5-year-old.
Just go, and see what happens, okay? They're going to be annoyed, and they're definitely going to feel something. Now take a paper towel, okay? This isn't even a cloth, a mask, even a surgical mask or whatever, just a paper towel, and then sneeze, with your friend there, and you're going to see that it's going to prevent something, okay? So whether you're wearing the mask or your friend's wearing the mask, it's going to help a little bit. Now keep in mind that it's mucous membrane, so that includes your eyes. So if you're going to be around people who are not taking precautions, particularly, then I would recommend getting, glasses. They have, you could go hardcore with the scubas, outfit, but, even just regular glasses, they're not as good. But they'll work. For me, I was wearing glasses in clinic for a little bit. They have these glasses that don't have prescriptions that you can get. You just get them on wherever, Amazon or wherever it is. But with the mask, then it was fogging up my glasses. So I probably, if I have to do that again, I would use the goggle version so that they don't fog up. But that's what I would say you do if there are other people around who aren't wearing masks. Or again, you can try taking the prophylaxis that we talked about. The herbs, I think, are the best. Second best would be, taking quercetin and zinc, taking vitamin C, getting, your sunlight, these types of things. Those
Eating
all
a lot
help.
of garlic.
Eating garlic. Yeah, garlic actually is better than the other ones because in terms of data, there's better data on garlic than any of the other things, short of all the Chinese herbs. But the garlic actually is it is a Chinese herb also. So next question.
Oh, it was about dementia and COVID.
Dementia. Okay, yeah. I don't know.
I haven't read anything about that. Have you read
No.
about Yeah.
No, I don't know anything about dementia and COVID. So.
But it makes sense.
It's a vascular disease.
Yeah, and if it's an elderly person, usually elderly people have dementia, so they're probably at higher risk. So, and then there's a question about exercise. If you're exercising, should you wear a mask? Okay,
so the downside of masks. is that they don't allow as much oxygen to get in your body, and you will rebreathe some carbon dioxide. And how that affects you is going to depend. So if you're the type of person who sits in a room with a bunch of people and you get anxiety and you have to have a window cracked open in the car all the time, and all that type of thing, it's likely to be a carbon dioxide issue. And so a mask may be difficult for you. In exercise, you're going to want to probably not exercise in a place where there's a lot of other people. You can exercise outside and not have to, not need to wear a mask, unless you're around other people. So that would be my advice. You have to look at yourself. And also, by the way, with masks, and we posted about this recently, if people are wearing masks with those little, those valves in them, those valves, the purpose of that is to try to protect the person wearing the mask, but it lets all the air out unfiltered, typically. So you don't want to be around those types of people, right? The people who are wearing that, they usually don't know, by the way. They just know it's more comfortable for them to wear the mask with the valve in it. But you can say in your groups of friends and things like that, okay, here are the rules that we're going to establish. Nobody wears masks with valves in them. Everybody's going to wear a mask. You just set up your rules. And by the way, you can also, if you've been quarantining yourself, and you have some friends who've been quarantining themselves and nobody's really gotten it, even if you're not masked up and you're around other people, the chances are probably pretty low that if you're, staying around this sort of select group of quarantining people, that anybody's going to be getting anything or spreading it. But you don't know what other people are doing or not doing. So I think masks are the best policy in most cases for that. Clarify the question about dementia. It's more for people who have the Alzheimer's.
It's the ApoE. Are you talking about the ApoE4? Because if it is the ApoE4, it is greater likelihood.
Okay, great. Thank you.
So then the next question is, can you heal from lingering long-term damage of COVID? Absolutely.
Yes. Yeah, and we've seen that already, and we haven't even been treating for that long. So I have some patients, and these are patients who I've seen in the past. For example, their pulses were normal in certain positions, let's say, and then all of a sudden we see they have choppy pulses and they have symptoms. So the choppiness is going to basically mean that there's some damage that happened to the actual tissue because the blood isn't flowing smoothly through the tissue. And so, that together with the symptom profile that they have in terms of remaining symptoms, then when we treat them, that tissue tends to heal. Now, if you wait a long time, sometimes it takes more time to, it's almost like with strokes. If you get to, for example, someone who gets an ischemic stroke, if you get to them within 24 hours, acupuncture will at almost 100% get function back, almost every single time. If it's an ischemic stroke. If it's a hemorrhagic stroke, it's a different story. But it's the same sort of thing with this. If you start treating it right away, you don't wait for it to set in and have problems, then it's much more likely that you'll be able to return function to normal. Now, we've only had something like 20 cases, so we don't have enough experience to tell. I can't tell you from a vast body of experience treating post-COVID. But from what we've seen so far, yes, you can reverse that type of damage.
Okay. Let's see. Oh, cats. Is there a transmission, or can you transmit COVID between cats and humans?
Okay, so that is something that we're assuming you can, but we don't know because the study would be unethical to do. Like, how would you take a cat and take a person and say, okay, let's see what happens if you're playing with this infected cat? That's not going to get by any IRB anywhere. So that's going to be something that we don't know. But given that it was actually transmitted from an animal to a human, chances are pretty likely that you would be able to catch it from an animal. Now, dogs apparently don't catch it as easily as cats. If you have ferrets, they tend to catch them fairly easily. Actually, they use ferrets because they're, I guess, closer to humans in that aspect. They use them to study vaccines, so they're using it for the coronavirus vaccine and for flu vaccines. So yeah, they know that it can be transmitted between animals and presumably, between animals and humans, unless in fact it was a manufactured virus and never actually hit an animal and just went straight into humans after manufacturing. I can't say for sure with any of that. So
there was a question about second wave.
Second wave. So second wave, do I think a second wave is going to happen?
Yeah, and how intense will it be?
And how intense will it be? You know, I don't, I would be surprised.
Aren't we already there?
Yeah, I mean, some people are saying maybe. It's very difficult to say whether there's going to be a second wave because there are so many different factors that could play into that. Because it's changing so rapidly, there are a number of scientists who think that it's just going to be like the flu, and we're going to have an annual coronavirus or maybe biannual coronavirus, and we're just going to have to keep getting new vaccines, just like we try to do with the flu, and so that's one scenario. It's really hard to say at this point. The effect that the antibodies are going down so quickly. It even suggests that if that's the case, we may even get reinfected with the same ones. So I would be very, I won't be surprised if we keep getting infected with the coronavirus. I will be surprised if the coronavirus doesn't become more like just a common cold again, like other coronaviruses, and really isn't a big deal after a period of time, maybe another 6 months, maybe another year. But I think it's going to mutate to be less and less of a problem over time. And plus, we're going to get treatments. Already we've seen, at least from our end, we see Chinese herbs are very helpful. They're working on these things, like I mentioned, that cow studies. And if people would just stop funding the vaccine things, they're putting so much money in vaccines just because it's, Bill Gates and this whole, pharma thing for the vaccines. Because, if you give everybody something, it's a lot more profitable than if you only give sick people something. But the reality is that the vaccines are just not going to work. In terms of eradicating the disease, and the best thing is going to be, because honestly, if you're going to rush through safety studies, which is what they're doing with the vaccine, so they're not testing this, you're going to be exposed to something that they are not testing properly for safety. If you're going to do that, it doesn't make sense to give healthy people something that hasn't been tested. But if you're going to give somebody something that hasn't been tested well, then give it to people who are on their deathbeds and are really sick, and that's going to be treatments. Right? That's going to be coming up with treatments, and not taking hydroxychloroquine and running a study on it without zinc, which it needs in order to be effective, and then saying hydroxychloroquine doesn't work. I think you need to, before you make judgments on things, you have to actually do the studies properly. And this is the problem, is that the general public has no way of differentiating what's going on. They're just like, I don't know, how do I figure this out? Most people have no idea that zinc should have been part of that protocol. So anyway, I think that's where we're at. It's just that my guess is as good as anyone else's, but those are my thoughts on that.
Soapbox. Okay. So another question was, foods we should eat. We kind of touched upon some of the foods already.
Yeah, garlic. Garlic's good for those. A lot of the fruits and vegetables. It's just the basics, fruits and vegetables. Some people are saying like oatmeals with the beta-glucans and things like that, but there isn't really there's a lot of good theoretical data on these things, but no good actual studies. We know
that there are certain foods that affect the immune system, but not so many things have been tested against COVID-19. So we just wanted to be as specific as possible, like things that actually work.
Right.
So, okay, so someone was asking about the type of mask to use.
The type of mask. Okay, the best mask in my opinion, the best mask to use is a surgical mask.
Garlic is good for social distance.
This is very true. That'll keep people exactly 6 feet away from you. All right. So masks, yes. So surgical masks, I think, are the best. It allows you to breathe the best. It blocks the transmission of most of the particles. When you're sneezing or coughing, the person who's wearing it.
It doesn't droop all over the place when you're talking.
Right.
If you're wearing it correctly.
Correct. I mean, they're easier to form around the face and so forth. They're not as, you're not going to get as much carbon dioxide poisoning from wearing a surgical mask all day long. And they're the least expensive, or, maybe not as inexpensive as a cloth mask or something, but.
Well, I don't know if it's, in short supply now. People might have to get it like on the black market. I don't know.
Okay, so but I see surgical masks all over the place. So I think they are available. That would be my preference. N95 masks. First of all, they're usually not fitted well. for people, so they're not actually doing what they think they're going to do. And also, that's something that does make it more difficult to breathe. So if you're exercising with an N95 mask, that would be good if you're training to go to Tibet or something, where you're going to be at really high altitude, so you're going to be oxygen deprived. But if you're older, let's say, you don't want to be oxygen deprived while you're exercising. That could lead to all kinds of cardiovascular problems. So N95s are okay, but I really think that they're only preferable if you're in a hospital setting or you're really close to somebody and you're trying to protect yourself, in which case you need all the rest of the PPE or it's not going to work. Now, if you use a face shield, there's some people who are using face shields and no mask. And that's, still a lot of air can get around it, but still, if you sneeze and you have a face shield, it's not going to go projecting out towards the other person. So a face shield is another option for people who don't want to, wear masks or can't wear masks. So those would be my opinions on that. Cloth are okay also. Again, if you take the mask and you sneeze on it and it doesn't hit the mirror, then it's going to block enough to help other people.
Yeah, and then also someone was asking about the how often to clean your mask.
Oh, how often to clean it?
Yeah.
That depends on how you're cleaning it and what type of mask. That's a very challenging question because some masks will degrade the parts that are effective. So the N95s, they work also through this sort of static electricity kind of a thing. And if you spray them with certain, ingredients, then it can affect that. So it depends what you have. If you have ultraviolet light, then you have shadows. There are all kinds of problems with everything. I would say, for what we do, I'd say every shift I'll spray it down once. We use hypochlorous acid. Sometimes we use alcohol to spray our masks with. It's not perfect, but that's what we do. I'd say probably if you're wearing it all day long and you're out, I would switch masks maybe 2 or 3 times and then spray them down in between that. And remember, the outside of the mask is going to be the most contaminated, really, because that's going to be what's blocking in anything from outside. So when you grab your mask and take it off, just keep in mind your hand's going to be contaminated potentially at that point.
And then there were questions about asymptomatic transmission, because there's so much information about that.
Okay. If I exercise outdoor wearing a mask and someone passes by me 6 feet or more, mostly runners without a mask, is the mask effective? Honestly, outside, even without masks, it's very difficult. Somebody would have to really cough right on you or right in your direction or sneeze right at you. It's going to be so diffuse outside that I really wouldn't worry much about it. The other thing you can do is if somebody's not wearing a mask and you're worried about it and you're running by them, just hold your breath for a couple seconds while you're jogging past them. Breath holding is a great way not to get something to go into your lungs. So just don't hold it too long. If you're running, you don't want to pass out, then it's going to be more of a problem than that.
Right. And then
I don't get airsick ever and got so airsick both outbound and on a return flight today that lasted for hours after landing. Could that have been from inhaling my own carbon dioxide because of wearing my mask? Yeah, absolutely. So for Soraya, yes, that could definitely have been from that. It's often from something like that. Yeah, and even without it, I mean, the oxygen levels are lower in air flights anyways. So that's why they have oxygen masks that come out if there's more of a loss of air pressure. Thoughts on asymptomatic transmission? So asymptomatic transmission, I think I mentioned it earlier, but just in case I'll mention it again. I think if both the person who is asymptomatic but has COVID and the victim are wearing masks, then I don't think that's going to actually occur. I don't think that there will be transmission unless something really out of the ordinary is happening. Somebody's hacking on their hand and wiping it on the other person. I mean, this would happen maybe in children, like in little children, but I don't see asymptomatic transmission as being much of a problem when people are wearing masks. Won't it be worse with flu season? Yes, that's one of the big questions, one of the big problems. Now, keep in mind, in every flu season, there are many different viruses running around at the same time. The last flu season, the CDC went around sampling, I think it was 20-some states, and they came up with 250 different flu viruses. 250 different ones. So we're really, this idea that there's just 1 or 2 or 3 flu strains running around is just not true. And when we're talking about flu and cold season, we're also talking about coronaviruses. I mean, all these years, we've had plenty of coronaviruses around. We just never heard the term coronavirus because it hasn't been this bad, right? This type, it's like certain flus are really bad, right? H1N1 in certain years were fairly severe. So there's questions about that. There's questions about some studies that have come out on the flu vaccine, because some people, when they get the flu vaccine for a few weeks, they become more susceptible to other types of infections. So then someone brought up, well, if you get the flu vaccine, is that going to potentially make you more susceptible to a coronavirus infection? And the jury's out on that one. I don't know what to say about that. But that's one of the main things they're worried about, is if you get the coronavirus on top of the flu, what happens? But also keep in mind that in the end stages of the disease, the thing that they think is killing people is not the actual bug, but the immune system's response. And this is one of the reasons why dexamethasone, which is a steroid, which basically blocks your immune system and knocks your immune system down, seems to be effective in the later stages, but they tell you not to take it in the early stages because that would allow the virus to run rampant in your body. So just because you get 2 different viruses at the same time doesn't necessarily mean, it doesn't guarantee you that you're going to have a worse disease. And in fact, I won't be surprised if people actually do wear masks and practice social distancing. I won't be surprised if we have one of the lowest flu season deaths that we've had in a very long time, if ever. So, okay, somebody, Jasmine, I bought surgical masks and they made me feel very dizzy and I wasn't feeling well. I bought a new set of masks, latex-free ones. Could it be that I'm allergic to latex, or was it carbon dioxide? Well, that could be, it could be either, because there are, obviously, who knows in the manufacturing process also what kinds of leftover chemicals there could be, from those. So from that standpoint, wearing the cloth masks that you can wash yourself are more ideal than the disposable ones. Should I be concerned about getting the coronavirus through cuts on my hands? I am not particularly concerned, but I'm trying to think about how that would happen exactly. So just touching a surface with an exposed cut, because if you've got a scab over it already, it's really unlikely. And if you're bleeding and you're touching surfaces, it would be sort of a strange thing. You probably wouldn't want to be touching a lot of surfaces if you were bleeding. So I'm not really concerned that would be a major source of transmission. And even when they're looking at these things, they're coming out and saying now that they don't think that touching things is really a major source of transmission. They think it's primarily through respiratory droplets. And that's why masks tend to be one of the only things that seems to make not one of the only things, one of the main things that makes a difference that's modifiable. So lockdowns, for example, in a recent study, a fairly large study that came out, and they looked at a lot of things. Lockdowns did not help. It didn't change the outcome. And, stay-at-home orders didn't help at all. There were a number of things that you would think would help, but they didn't. Closing down schools didn't help. But masks helped significantly. So that's definitely something that I think, I don't think we should do lockdowns. I don't think we should all stay social distanced from the standpoint of not socializing at all. I think that we should. But if we do it with, masks on, I think we can lead a, semi-normal life without having to, stay at home all the time.
Well, and in a well-circulated place.
In well-circulated areas, yeah.
Yeah, and then Matt asked about transmission through recirculating air and enclosed spaces. Well, that goes along with, it's better to just be outside.
Yeah, I mean, at this point, any place that's recirculating air. Oh, okay. Instagram Live has it. Okay, we may get kicked off of Instagram in a minute. But anytime you have recirculating air.
We have 2 minutes remaining.
Okay.
Hurry.
I'm trying. Anytime you have recirculating air. Okay, we're back. Anytime you have recirculating air, if it's not filtered, really there's going to be more of a risk there. It's going to concentrate the particles more and more, so I just don't recommend being in that kind of situation. We have air cleaners in all of our treatment rooms, and any place that you're going to have the public, I think, should have air cleaners.
And in terms of if you need to travel on the plane, what should you do?
Okay, so if you have to travel, then, I would say garlic. That'll keep people away. Essential oils can probably be good. I'm telling people, thieves oil is one. That's what you can commonly get. You can smell those a lot or dab it on, put it in some smelling salts or dab it on your shirt or something. I wouldn't put it neat on your skin, like directly on your skin, because they can be toxic.
Strong.
They're strong. Essential oils should always be diluted if it's applied topically. You should take a lot of vitamin C. Definitely try the quercetin and zinc. For sure, take Chinese herb. For me, the main thing would be Chinese herbal medicine if that was something I had to do. Because I look at that as being risky.
Right. And then,
Eczema Society said those are lots of cuts on their hands, and they indicated it's not a source of transmission. Yeah, thank you. That would be my guess. So, all right. Well, I think we're about to get kicked off.
We have 20 seconds. So thank you very
Thank you,
much, everyone.
And
I hope you got something out of it. And you could always direct message or email us if you have any other questions.
All right.
Bye.
Bye.
Finish.